One Detroit contributor Stephen Henderson stepping in for Zoe Clark. Healthcare in Michigan is at a really pivotal moment. Rising costs, workforce shortages, and a growing demand for accessible care continue to challenge providers, employers, and families all across the state. Joining me now to dive into these topics is Tricia A. She is the president and CEO of Blue Cross Blue Shield of Michigan. Tricia, great to see you.
Hello, Stephen. Great.
So let's start with, you had some big news to announce today. The dispute, or the potential dispute, I guess, between Blue Cross and the University of Michigan hospitals is over.
It is over, and we're delighted to be able to announce that we were able to come to a contract agreement with Michigan Medicine. It preserves access for about 250,000 people who need and want to access Michigan Medicine, their doctors, their physicians, their hospital systems. And so we were thrilled to be able to announce this to protect that access and affordability.
So we were talking before about how few people really understand what that kind of dispute is about, and I guess how common it is across the country that in many states you see these arguments between insurers and providers about how the money works.
Well, over the last year and a half, we've really been starting to raise the conversation about affordability, and because we recognize when people are getting insurance premiums and they're going up, they're angry because affordability is a really hard subject. So we've been talking about the cost equation and how hospitals, doctors, drug companies, Blue Cross, how the system needs to work better together. Well, when the hospitals are 47 cents of every dollar of an insurance premium, you have to change the game and have different ways to work together. And so when hospitals and insurance companies are trying to work together, in the end, trying to get the right care at the right price for the member, there are going to be conflicts, and there have been a number across the country of departicipations when insurance and providers just couldn't come together. Now, I'm thrilled that our partners at Michigan Medicine, we came to an agreement. It was really important that we get there. We were both really committed to stay at the table, and we worked hard to do that, but we delivered.
So if that had come apart, and if, let's say I was a patient at Michigan Medicine and I had Blue Cross, what would have happened to me as a patient?
Well, when Michigan Medicine decided that they would quit taking our card and our customers, they were forcing their members, their patients, to make other choices, and that's why it was important we got to agreement, and we're so thrilled we did.
Get other insurance, you
would have to find another provider. And so one of the great things about Michigan, though, because of our role in the health system, is we have incredible quality, high quality health systems across Southeast Michigan and frankly across the state. And so Trinity, Henry Ford, Corewell, all the DMC were really working with us to make sure that if those patients had to go somewhere, there would be no interruption in care. We recognize it's still more than an inconvenience to have to make that change, but we wanted to make sure that people did get the care. But we don't need to do that. We are at an agreement with Michigan Medicine, and a long-term agreement, hopeful that this doesn't happen again.
So you mentioned that 47 cents of every dollar and a premium is going to hospitals. Where is the relief for that pressure likely to come from? I mean, the hospitals, I think, would say, look, that's our cost, and the costs are going up, so that's why we do that. How do we move that down so that everything's more affordable?
Well, costs are going up across the system, but frankly, the system is not working well either. And we think each component of the affordability equation has its part to improve what it does. Certainly, hospitals can be more efficient. Blue Cross, for our part, we take 8 cents out of every dollar to pay claims, answer phone calls, do those types of things. But that number was 9 cents last year. So we actually took a penny out of that overall dollar that a member pays in just 1 year because we were committed to affordability. We need to do that with the drug companies. The hospitals need to do that. And then, frankly, the interface between us needs to work together. And it's why we've built a number of the programs, for instance, like value partnerships, where we incent the right outcomes and we pay for the right care at the right time at the right price, because in the end, that's how it's going to lower the premium. Just one more statistic. In 2024, for every dollar that we took in premium, we paid out $1.04. We brought that down to $1.02 in 2025, but obviously that's not sustainable. And so we need to bring the costs down in the system, but still making sure that people are getting the care that they need.
I was reading a stat before we started talking about what Michiganders think about their care. 68% of people say that they're having a hard time affording their care. That's it's a huge number.
It's a
now,
huge problem.
At the same time, we're in the top 3 of all states in terms of how low our premiums and things are for insurance. So we're doing better than other states, but people are still feeling that pressure and that pain.
Affordability is really, at the board we talk about affordability is not necessarily affordable, and so what it means to a person, and that's why we've got to bring those solutions forward. The Small Business Association just released a study that said 45 or so % of employers are considering dropping coverage in the next 1 to 3 years. But right now what they're doing is they're putting off hiring because they're absorbing the increases and they're making real choices. And when we're here to talk about the economy and what we need to do in Michigan, we need all the good jobs that we can have. And so we recognize the overall impact that has. And that's why we're having the uncomfortable conversations about some of the changes that we need to make across the system.
This week, the theme is finding common ground. Of course, Blue Cross always plays a very large role in the conference up here. What's got your attention about the agenda up here this week?
We're very supportive of what the Chamber does here. We have 25,000 members through the Chamber that carry our Blue Cross coverage and have confidence in that card. I really like that we're having real conversations about what is. I think we can still celebrate successes and what's good, but also it's talking about the things that we need to change. And when we see the real data of how we're doing around literacy, when we see those types of things, we've got to address that and have the real conversations about the change necessary to impact the future. We keep talking about things like literacy and jobs, but really it is about the sort of attractiveness of Michigan, right? All of these things feed into whether a business wants to locate here, health premiums and coverage and all of those things. It's all got to work together, and I think that's where we sometimes fall down. Well, that can be the real magic because all of those entities are here, and that's the conversation I hope that this drives.
About.
Exactly. Exactly.
I'm going to ask you to talk a little politics.
Okay.
Are you surprised that Mike Duggan is not going to run for governor? And what does that mean for the future here in Michigan?
I was surprised. Frankly, I thought it was a bold decision to enter the race as he did. I think that was a surprise as an independent.
A really different conversation than we normally have.
It did start a different conversation. I think that is really part of the legacy value of that run and what it is. But I think we also have to ask ourselves, are we so entrenched in the current system that someone as talented as Mike Duggan can't do that? And so what does that mean? I was surprised that he dropped out, but I think so. Hopefully we can take the lessons learned from that. We can have those conversations here and work toward a common ground, just like the theme says, on how we move Michigan forward. And I think there are a number of candidates here who can have those conversations.
Okay, Tricia Keith, great to see you.
It's great to see you. Thanks for the opportunity. Thank you.